Anxiety, When Anxiety Attacks by Carol Watley at Rasmussen College. Anxiety, by definition, is a feeling of fear or nervousness about what might happen. It is a natural response and a necessary warning adaptation in humans. It can become a pathological disorder when it is excessive and uncontrollable, requires no specific external stimulus, and manifests with a wide range of physical and affective symptoms as well as changes in behavior and cognition. It is the most common mental illness in the United States. It affects over 18% of the population. It is highly treatable, yet only about one-third of those suffering receive treatment. Other anxiety disorders include generalized anxiety disorder, or GAD, social anxiety disorder, also known as social phobia, specific phobia, panic disorder with and without agoraphobia, obsessive compulsive disorder, also known as OCD, post-traumatic stress disorder, PTSD, anxiety secondary to medical condition, acute stress disorder, ASD, and substance-induced anxiety disorder. Signs and symptoms of anxiety are feelings of fear, panic, dread, or uneasiness, problems sleeping, cold or sweaty hands or feet, or excessive sweating, shortness of breath, heart palpitations, not being able to be still and calm, filled with nervous energy, irritability, dry mouth, nausea, vomiting, muscle aches, tension, twitching, or trembling, dizziness or feeling overwhelmed, feeling weak or tired, trouble concentrating or thinking about anything else, loss of appetite, shyness, blushing, lack of interest in sex, having the urge to avoid certain situations and/or people. Anxiety and medical conditions. There are also certain medical problems that are directly related to anxiety or can worsen due to anxiety, such as heart disease, diabetes, thyroid problems such as hyperthyroidism, heart attack, stroke, fertility, cancer, acid reflux, high blood pressure, stomach ulcers, eczema, respiratory disorders such as COPD and asthma, lupus, drug abuse or withdrawal from alcohol, anti-anxiety medications or other medications, chronic pain, irritable bowel syndrome, depression, headaches, and insomnia. Anxiety's effects on the body. When the fight or flight is triggered daily by excessive worrying and anxiety, it causes the body's sympathetic nervous system to release stress hormones, such as cortisol. These hormones can boost blood sugar levels and triglycerides, which are blood fats, that are used by the body for fuel. When the fuel in the body isn't used, the outpouring of the stress hormones can have serious physical consequences, such as the suppression of the immune system, digestive disorders, muscle tension, short-term memory loss, premature coronary artery disease, and heart attack. The heart responds by increasing the heart rate and blood pressure. The lungs cause rapid breathing and take in more oxygen, and the spleen activates red and white blood cells to transport more oxygen to the body. Blood circulation may also increase, taking it away from the skin to the muscles, lungs, and brain for added support, thus leaving the skin cool, clammy, and sweaty. Stress often causes the hair to stand on end. The mouth and throat then become very dry, making talking and swallowing very difficult. It can also affect digestive activity by shutting it down, thus decreasing the appetite. Short-term and long-term memory are also affected by catecholamine. It suppresses areas in the brain, including memory, concentration, inhibitions, and rational thought. And these are necessary so a person can react quickly, triggering the fight or flight response. When this is activated all the time, it interferes with the ability to deal with social or intellectual behaviors at the time, or all of the time. Long-term effects. Chronic worrying can affect your everyday tasks. It can interfere with your appetite, difficult to regulate fear, and can leave a person anxious most of the time. To someone in chronic fear, the world looks scary, and their memories confirm that. Moreover, fear can interrupt processes in our brains that allow us to regulate emotions, read nonverbal cues, and other information presented to us. reflect before acting, and act ethically. This impacts our thinking and decision-making in negative ways, leaving us susceptible to intense emotions and impulsive reactions. All of these effects can leave us unable to act appropriately. Other consequences of long-term fear include fatigue, clinical depression, accelerated aging, and even premature death. Suicide, of course, being the absolute worst long-term, but preventable effect. Suicide is our third leading cause of death in youth ages 10 to 24. Suicide is the 10th leading cause of death in the United States. 90% of those who died by suicide had an underlying mental illness. Now, it doesn't break up the exact amount of what mental illness they had, but still it's a staggering thought. Risk factors. The exact cause of anxiety disorders is unknown, but anxiety disorders, like any other forms of mental illness, are not a result of personal weakness, a character flaw, or poor upbringing. As scientists continue their research on mental illness, it is becoming clear that many of these disorders are caused by a combination of factors, including changes in the brain and environmental stress. A few of the common risk factors attributed to or make one more susceptible to anxiety-related disorders are trauma or a traumatic event, stress due to an illness, work, home life, or other environment, excessive stress buildup, personality, other mental disorders, having a relative or relatives with anxiety, drugs and alcohol, and of course, brain chemistry. Treatments for anxiety. The two main treatments for generalized anxiety disorder are psychotherapy and medication. Psychotherapy is also known as talk therapy or psychological counseling. It involves working with the therapist to reduce your anxiety symptoms. Cognitive behavioral therapy is one of the most effective forms of psychotherapy for generalized anxiety disorder. Generally, a short-term treatment, cognitive behavioral therapy focuses on teaching specific skills to gradually return to antidepressants, including medications in the selective serotonin reuptake inhibitor, serotonin norepinephrine reuptake inhibitor, SNRI classes, are the first line in medication treatments. Coping with anxiety. As far as prevention of anxiety, it's kind of a hit and miss approach. What works for one individual may have no effect on another. If you are consumed with anxiety 100% of the time, it seems as if nothing will ever make it stop. There are just a few things one can do to possibly help prevent anxiety. Avoid alcohol and other chemical substances. Join an anxiety support group and stay socially active. Practice relaxation techniques such as yoga or meditation. Also, getting adequate rest each night and keeping hydrated can help ease some anxiety. Avoid caffeine, such as coffee, tea, colas, energy drinks, and chocolate. Caffeine can keep you in an aroused condition. Do not smoke or use smokeless spit tobacco products. Nicotine stimulates many physical and psychological processes and causes your blood vessels to constrict and makes your heart work harder. Exercise during the day, even a brisk walk around the block, may help you stay calm.